Great. Panelists, shall we? With your permission. Wonderful. So a very good evening to everyone on the call. On behalf of Catalyst 2030, Swasti and ISDM, I warmly welcome all of you to the first of our Catalyzing Change conversation series. There has been a growing realization amongst all of us working towards creating a more just, equitable, humane, and sustainable society that sticky change at scale cannot happen in silos, through one individual, one organization, or even one sector. Everyone serious about change needs to understand, appreciate, and adopt the power of cross-sectoral partnerships. While each SDG in its own way is critical in this change journey, SDG 17 adds a unique dimension to all of them. Change through partnerships needs to start with a deeper appreciation of the, within quotes, other, whether it's Samaj, Sarkar, or Bazaar. Understanding their context, their realities, their challenges, and working together to complement each other on this journey of change. With this in mind, we launched the Catalyzing Change conversation series, hoping that it will help us challenge myths and stereotypes about each other, and thereby help drive deeper appreciation and understanding. A warm welcome once again, and I now hand it over to Radhika, who is a social innovation and entrepreneurship catalyst at Swasti and the Catalyst Group. Radhika will be our host and will be guiding us through the rest of the evening. Thank you, and do participate.
Thank you so much, Gaurav. Kicking off from where Gaurav left off, in March 2020, all our lives got turned upside down. There have been very few times in the history of humanity when we have been connected at such scale. Now, obviously, a situation like this calls for us to rethink the way we've operated, and the very premise of our work gets called into question. To me, the pandemic came with a couple of big C's. Besides the obvious big one, COVID-19, another big C that we sort of faced was a crisis that humanity had, which is far beyond COVID-19 itself. And the third big C was that of collaboration. And interestingly enough, when you put these three in a sentence, you actually have the problem, effect, and solution. Today's discussion is really going to help us understand the science of collaboration with an incredible example that brought together the community, corporate partners, as well as entrepreneurs. This collaboration, though, was not prompted merely by COVID-19, but has a rich history that we'd really like to explore here today. With that, I'd like to welcome my panelists for today. Pooja Devi is a board member of the Sanjeevani Kalyan Samiti in Gurgaon. She's been associated with the Samiti for the last 5 years, and she now proudly holds a board position with them. Ranjeep Sharma is the head of compliance, CSR, and planning for the India and Sri Lanka region with Marks and Spencer. And Shiv Kumar is the co-founder of the Catalyst Group. As I said earlier, we're going to be dwelling into a solution that was actually not the result of COVID-19, but that came with a very rich history. And to explain that history to us, I'd like to invite my colleague Smriti here. She's a community institution specialist with us here at Swasti. Smriti, I'd love for you to tell us about the story of this collaboration.
Thank you, Radhika. Thank you very much. Good evening, everyone. So today, I'm here to share a story of a partnership which took place 6 years ago in an urban slum of Gurgaon named Mohammadpur. So in a quest of finding meaning to factory workers' lives and their families and making a difference in their lives, Marks and Spencer Catalyst Group and community of Mohammadpur came together in 2016 to address a central question. How do you co-create a life of everyday well-being for a community worker living in poor conditions, prey to gamut of diseases and disorders, struggling for a basic survival? To find simple answer to this very complex question, the journey of Invest for Wellness program through this partnership, and we call it I4V, began. So we started with an initial assessment study in the community, which brought us concerning findings on health and well-being parameters. Some of them are laid out here on the slide for all of you. For example, a lack of access of quality primary health care, tendency of unattended illness episodes and then turning into chronic diseases, lack of information on subjects like menstrual health and hygiene, lack of awareness on out-of-pocket expenses on health, so on and so forth. Another early realization for this partnership was to understand the dynamics of the community in Mohammadpur, which was mainly fragmented between locals and migrants. Locals who lived there for generations and migrants who had left their hometowns, their villages in search of livelihood and have settled in urban slums like Mohammadpur and Gurgaon in hope of making a living. It was also evident to see that migrants who actually outnumbered the locals never got into any decision-making role, be it social, political, or otherwise. So this partnership further understood these challenges and began its journey, first of all, by organizing the community into smaller informal self-help groups, further collectivizing them under an umbrella organization. Today we call it Sanjeevani Kalyan Samiti. Sanjeevani Kalyan Samiti was not only the first organization in Mohammadpur, but also among all similar communities where it brought migrants and locals together to identify and dialogue on common social needs such as health, gender, water sanitation, financial inclusion, social security, and justice. So it began its journey by setting up several primary response systems for early addressal in the community, which included a primary healthcare clinic, a social protection help desk, a livelihood training center, and a cooperative which provided financial products like savings and credit. The common thread among all these services was the design of it. They were highly customized for the community needs and designed by the people for the people of the people. This program also focused on setting up a lab for addressing health and environmental issues through a range of innovation, such as setting up a hanger sorting unit, piloting some infrastructural design solutions like soak pit, hand hygiene station, and introducing some preventive healthcare products. However, this program also continued to strengthen the capacities of local leadership to take this on for a sustained intervention. However, the partnership further deepened during the testing times of COVID. During the first and second wave, Mohammadpur Jharsa reported lowest number of people infected with COVID-19, despite having a very poor infrastructure. It was also one of the first to be 100% fully vaccinated community. How could this happen? Simple. This partnership again came together and set up an early primary response system. This primary response system included a COVID care management system, which focused merely on early testing, mass testing, early diagnosis, early treatment. It also focused on introducing self-testing kits to the community members. Along with it, a special focus was on mass vaccination campaign, by which more than 20,000 community members were vaccinated in Mohammadpur itself. And other than that, the partnership continued to mobilize emergency relief services for the poor and vulnerable community members. Thereby, COVID times prove the importance of such meaningful partnership, which are based on shared intent and mutual respect. Today, Sanjeevani Kalyan Samiti has around 2,000 families as members moving on the lives of well-being living, which they have dreamt of. And this is how a dashboard of I4V Mohammadpur 6-year journey looks like. As they say, when you do things from your soul, you feel a river moving in you with joy. Thank you very much for listening to me patiently, and I hand over the discussion back to Radhika.
Thank you so much, Smriti, for such an inspiring story. Before we get started on this panel, I'd like to welcome the most important part of our panel discussion, our audience. A very warm welcome to each and every one of you. We'd encourage you to please participate in this discussion. We know that you're muted, but you have the Q&A section. Feel free to use it to ask any questions. We'd love to answer these questions. With that, I'd love to kick off our discussion by addressing my first question to Ranjeev. Good evening, Ranjeev, and welcome to the panel discussion. Kudos to M&S for having supported such an incredible program for the last 6 years. Can you tell us a little bit more about, your journey of co-creating the design and, supporting it for such a long period of time? How did you make this happen? This wasn't easy, obviously. Sorry, Ranjeev, you're on mute.
Technology. All right. I think it has been a very interesting journey. And, in fact, I was sharing with somebody, and, wherever I go, I'm myself very, very surprised that how much we achieved, and I was looking at this whole presentation by Smriti. It is very, emotional and also in a way satisfying that, what we were able to achieve together. And it's been 6 years, and it's like time flies. But I think in the end, when you see a lot of water has flown, and I think continue to flow in the form of from going from this part to the next level. And one of the, I think, main points of this wonderful program was its innovation in its core, and a program which was envisaged as a program that would maybe connect the rural community in an urban setting to a formal healthcare system, to today, a integrated approach where we are also looking at telemedicine, we are looking at legal counseling, we are looking at livelihoods, we are looking at carbon footprinting. I think this program has got it all. So I think from a traditional CSR perspective, it is a welcome change, and it actually fits well in our scheme of things. And in Swasti, we actually got a very, very good partner where we were able to co-create this program. And today you see the results. I mean, from I think. When we are talking about migrant workers, for example, I think it's an international concern, and interstate migration. I think a good example was seen during the pandemic. I mean, it taught us all, how people who move from one place to another, the issues they face, and this program was able to actually cater to those workers. And today, as we look back, I think the cluster where we are working, I think most of them are migrant workers, and they have been aptly benefited through this program. So yes, I think we are very happy to support this program, and would continue to look at further innovations, that actually emanates out of it. And the other part is the scaling up. So it's not that, of course, if you see that, Mohammadpur is a lab, but today it's actually scaled up in different places. So it was so nice to hear from another organization talking about this program in MP, for example. And then they are looking at co-creating or maybe innovating a similar model with a slight maybe change. But this program, feeds as a base. So yes, it was fantastic.
Thank you so much, Ranjeev. I'm going to go back to a sentence you said that stuck with me. It's like water that flows. I really like that statement because, water flowing requires time to create a path. And I think through your program, you really demonstrated how this multi-year support that you were able to provide allowed this program to really go from a small little creek to a river that it is right now. How easy or difficult was it? Can you talk through some of the complexities of you as a corporate partner playing a role here?
Right. Okay, unmuted. So I think learnings, they come from complexities, right? And I think the major complexity was, I think it started from day one. Like when we first visited for a needs assessment, we saw the moment we actually entered that place, we saw we finally we actually felt that we are in a very, very different space in terms of maybe the appreciation people have towards life from a health viewpoint, and also the approach. But interestingly, what we were able to find out, navigating those complexities. In fact, I think one statement might sum it all. When somebody asked me that, what do you think? Because this program was essentially women centric, because we used the gender lens in the second year. But what was the contribution of men? The answer was they allowed us. So I think the interesting part of this program was, in terms of bringing them to our side, and they did not become an impediment. I mean, you walk into a village where women were in ghungats. Of course, it's a tradition, but it's so nice to see that today they are in aprons, and also maybe going about their lives, taking lead, talking about the importance of potable water, talking about hygiene and sanitation. It was so nice to see children doing that hand washing dance. And last but not the least, during the pandemic times, I think the Noble Plastic program, which was added as a livelihood program, plug-in for the program, was able to actually fund the salaries of the workers, where most of the people, they cut salaries, people were not paid money. I mean, it is a very complicated situation, and plus on top of it, you have the migrant workers, and they were stuck. So the involvement of the Marks and Spencer non CSR team, through the volunteering program. Again, thanks Smriti for orchestrating it so nicely. It was phenomenal. For the first time, also maybe it was actually catering to the Indian audience. So because this was a India-driven program, and Marks and Spencer is a UK-based company. This was a very important facet of this program, where the normal employees of Marks and Spencer were able to counsel, or call and maybe provide telesupport to the community, and then of course the amount of difference it made to them, the people who were calling, to the employees of Marks and Spencer, and also to the community, was phenomenal. So navigating through these complexities, I think it was really the journey was worth it. And again, it wouldn't have been possible if there was a lack of understanding from the ground, from both the sides. maybe Swasti's appreciation of how Marks and Spencer as a corporate works, and in turn our understanding of our organization, which is local but global in its approach.
Thanks, Ranjit. A lot to take away from what you said. Let's shift focus a little bit to what was going on the field. Namaste, Pooja ji. पिछले 6 साल में मोहम्मदपुर में काफी कुछ हुआ है. अलग अलग के फंडिंग एजेंसीज आए, अलग अलग के पार्टनर्स आए. ये सब आपने मैनेज कैसे किया? ये काफी कुछ मुश्किल काम था. आपने ये सब कैसे किया?
जैसा कि मतलब ये बिल्कुल सच है कि हमने 6 सालों में जो भी काम किया, जैसे प्रगति की, अलग अलग जगह से फंडिंग आया, तो उसमें उतार चढ़ाव भी बहुत आए. तो मैं कोशिश करूंगी कि आपको संक्षिप्त में बताऊं. ऐसा कि जैसे मार्क स्पेंसर, कैटलिस्ट ग्रुप, स्वस्ति से जो भी हमें सपोर्ट मिला, इसके अलावा हमारे मिग्रो से भी हमें सपोर्ट मिला. आर्थिक स्थिति के दौरान अलग अलग अनुभवों से भी मिला. तो वो काफी उतार चढ़ाव जनक स्थिति रहती थी, क्योंकि लोकल और माइग्रेंट के बीच में काम करना और इनकी जरूरतों के मुताबिक, समस्याओं के मुताबिक अलग अलग परिस्थिति में अलग अलग डिसीजन लिए जाना, ये काफी मुश्किल था, लेकिन फिर भी रोचक था, क्योंकि हमें इनके साथ जब काम करना है तो ऐसी स्थिति आती रहेगी. हमें कोई भी काम, बड़ा काम करने के लिए, उतार चढ़ाव के लिए हमेशा तैयार होना पड़ता है. फंडिंग आ रही थी, ये बहुत अच्छी बात थी हमारे लिए सपोर्ट था, लेकिन हमारा उद्देश्य था कि अगर हम काम करना है हमें, तो फंडिंग आती रहेगी कम या ज्यादा, लेकिन हमें अपने काम को निरंतर रखे रहना है, जारी रखना है. तो हम भी धीरे धीरे अपनी तरफ से भी प्रयास करते रहे हैं. सिचुएशन के मुताबिक अलग अलग ढंग से, अलग अलग सपोर्ट से हमने भी बहुत कोशिश की है अपने समुदाय के साथ काम करने के लिए. मिग्रोस ने जैसे कि मतलब उन्होंने जब सपोर्ट, उनका जो फंडिंग आया, उनका जो सपोर्ट आया, वो भी काफी उत्साहित जनक माना जाएगा हमारे लिए, क्योंकि वो कोविड के दौरान में उनके तरफ से खुद से आया था वो, कि वो हमारे लिए, हमारे समुदाय के लिए अपनी तरफ से कुछ करना चाहते थे. एक नया सोच, एक फ्रीडम तरीके से उन्होंने वो मौका दिया. तो कोविड जैसे कहर जो था, वो आपदा थी जिसके लिए हम कोई भी तैयार नहीं थे. यानी कोई भी का मतलब कि पूरे देश तैयार नहीं था. तो ये तो एक छोटा सा गांव था, तो हमने हमारे समुदाय में भी एक आपदा की तरह ही हमने इसको देखा और झेला. लेकिन इसके बावजूद भी हमारी टीम ने जोर शोर से इस पे काम किया, क्योंकि हमारे लिए वो एक सबक भी था कि इस दौरान हमने बहुत जल्दी में क्योंकि 6 साल से तो ऐसे स्वस्ति का मतलब स्वस्ति और मार्केट से मिलकर स्वास्थ्य पे काम करना शुरू किया. धीरे धीरे उसमें प्रगति शुरू की. स्वास्थ्य उसमें हमारा शारीरिक आ गया, मानसिक आ गया, आर्थिक आ गया. अब हम रोजगार पे भी थोड़ा सोच रहे हैं. तो ये सब इतना आसान तो नहीं था, लेकिन कोविड एक सबक था कि आपदा में भी हम किस तरीके से लोगों को बिखरने से रोक सकते हैं. तो उसमें जैसे कि हमने ऑनलाइन सेवाएं जारी रखा, कि हमारा घर से निकलना बंद था, तो हम ऑनलाइन जरिए लोगों तक पहुंच सके, उनकी जरूरत को, उनकी परेशानी को जान सके. हमारी नर्स, हमारी जो दवाओं की सेवाएं हैं, वो उन तक पहुंच सके. जो कोविड से ग्रसित थे, उनके लिए भी हमने एक अलग केयर किया रखा, जिसमें कि उनकी क्या जरूरत है, वो कैसे रिकवर कर सकते हैं, उस पर हमने काम किया, मीटिंग की, लगातार जुड़े रहे. जैसे कुछ सुविधाएं, जैसे राशन वितरण हुआ, हाइजीन किट हुई, होम क्वारंटाइन किट हुआ. कोविड मैनेजमेंट को इस तरीके से हमने बनाया कि कोई छूट ना जाए. इसके लिए हमने एचएफ द्वारा फॉलोअप भी लगातार लेते रहे. और ये सब उतना हद तक नहीं था, क्योंकि कोविड जब आया था तो वो अभी भी नहीं गया है. तो जाहिर सी बात है कि ये सारी सुविधाएं उपलब्ध मतलब पर्याप्त नहीं थे. तो हमने उसके लिए टेस्टिंग भी कराया, क्योंकि मोहम्मदपुर ऐसा एरिया है जहाँ दूर सारी सुविधाएं हैं. अगर स्वास्थ्य से संबंधित कोई हॉस्पिटल वगैरह है तो वो दूर है. तो ऐसी स्थिति में हमने टेस्टिंग पे ध्यान दिया कि टेस्टिंग करा के हम कोविड को थोड़ा कम कर सकते हैं, लोगों को जागरूक कर सकते हैं. तो हमने टेस्टिंग पे काम की, पीएचसी के माध्यम से हमने टेस्टिंग कराना शुरू किया. उसके बाद से हमने जिला अधिकारी के प्रशासन गुड़गांव प्रशासन के मैंने परमिशन लेके हमने वैक्सीनेशन पे काम करना शुरू किया कि वो एक जरूरत है जहां लोगों को दिनचर्या थोड़ा आसान कर देगी, कामकाज में थोड़ा राहत देगी। तो इस तरीके से हमने 20,000 से भी ज्यादा वैक्सीनेशन कराया, जिसमें हमारी सतवा, अपोलो, पीएससी की मदद से हमने इस तरीके से उस लहर को जिया। और उसमें हमने काफी अनुभव किया कि एक पार्टनरशिप जब आता है, हम कोई एक सोच लेके चलते हैं तो हम शायद परेशानियों को देख के, कठिनाई को देख के हताश हो जाते हैं, पर जब हमारे साथ कई हाथ मिलते हैं तो वो मुट्ठी बन जाते हैं और वो काम और वो उद्देश्य एकदम आसान होता है और वो कुछ अलग ही निखर के आता है। तो इस तरीके से हमने मैनेज किया, उसमें कुछ सीखा, कुछ जाना, और हर बार हमने एक नए ऊर्जा के साथ ये तैयारी की अपने समुदाय में कि परिस्थिति चाहे जो भी हो, अगर हम एकजुट होते हैं, चाहे वो हमारी एसकेएस जैसी कई संस्थाएं हो या मार्क स्पेंसर कैटलिस्ट ग्रुप की तरह सपोर्टर हो, अगर ये दोनों बराबर में मिलते हैं तो विकास, एक समुदाय का अलग ही विकास होगा और अलग ही उत्कर्ष होगा।
थैंक यू पूजा जी। जिस खुशी से आप बात करते हैं, मैं ये जानकारी, मुझे ये जानकारी है कि आप बिल्कुल परफेक्ट बोर्ड मेंबर है समिति के। थैंक यू सो मच। शिव, over to you now to talk a little bit more about, this image that Pooja painted for all of us. It really talks through this integrated programming that brings together so many different partners, agencies, donors. Having been part of these programs, I also know some of these were non-financial in nature. So what does it really take for this to work?
Lot to make it work. But I think I had, given it some thought, and I think thanks to Ranjeev and the Swasti team, which made us reflect on this journey. Recently, we spent 2 days together, and it's very unusual for a CSR head to not just invest this amount of time, but also heart, right? And I think we were able to seriously reflect what have we done and what can we learn from that, right? And there were 7 lessons which came out, Radhika, for me. One is tremendous impact alignment. Alignment at the community level, at Swasti level, at Marks and Spencer level, and all the stakeholders who worked on this, saying, look, we need to add healthy days back to these communities. Let's not talk about diabetes, hypertension, anemia. Yeah, those are all diseases and conditions and body parts. But can we talk about whole scale well-being of the community, right? And can we be very practical about it, right? And that is very, very critical. The second is recognizing complexity, right? Now, upfront, it's extremely important that complex problems can't be solved with simple solutions. It's easy to say that, but the answer is not complex solutions, right? We have to start somewhere. And that's where, we had to win the community's, heart and mind by being there for them. And that is where we set up the clinic, although we were not wanting to begin with the clinic, right? And to solve a complex problem, you need trust. And in health, trust is central. You will not go to any provider who you don't trust, right? And the third is really true partnership. And when I say true partnership, what I mean is respectful, clear about our own roles, and also very complementary and very trusting of each other. I think that's something which is, we have celebrated that partnership both with leaders like Pooja as well as with leaders like Rajiv and Nidhi, is because we gave each other the space, we respected each other's value, and we argued, we fought. But at the end of the day, we were very clearly aligned on the impact, right? And the fourth is the value-based design. What did our communities get? What will they get? This is a question MNS will keep asking. We will keep asking every time, because the design has to be in a way that the communities feel the impact on a daily basis, right? It's not about some impact assessment agency telling us what the impact was. Then came 2 important things, assemblage and sequencing. As Ranji was referring and Pooja was also saying, there were many moving parts. How do you assemble them? How do you sequence them so that continuously there is progress? And the second is high velocity implementation, which I think team led by Smriti did a fantastic job. I think Smriti could have done 1,000 other things in her life, but she chose Mohammadpur and that specific community and this particular set of leaders to work with, right? In terms of high velocity leadership, right? In terms of implementation. And lastly, patience. Because it's, again, a much spoken about subject, but hardly ever expressed. I don't know how much pressure Ranjib came under. Why is he funding a single project continuously, right? And we have argued about it too. And his questions have been spot on. But that patience, Marks and Spencer, if they had not shown about the long-term investment, I don't think we could have seen the result like that. If Pooja and team had not shown the patience with us as we bungled on in the first year, I don't think we would have achieved, right? It's the same with Smriti and same with other stakeholders, same with the bunch of youth who work there, right? All of them have definitely shown something which is very unique in terms of patience. So I would say, in summary, impact alignment, recognizing complexity, true partnership, value-based design, assemblage sequencing, high velocity implementation, and patience. Sorry, that's a mouthful.
Thanks, Shiv. Took me a while to note all that down. But thank you so much for that. As you're talking, it sounds so perfect, right? But all this comes in hindsight. It's not that was this part of the design, or was this just serendipitous that, all these factors came together?
No, I would say largely it was intentional, Radhika. It's otherwise, as Ranjib was pointing out, we couldn't have scaled this to other parts of India and right up to Lesotho, Bangladesh. Today, this investment in Mohammadpur has led to that level of scale up is only because it was intentional. I don't think they were, a fluke or something that we are retrospectively fitting into a narrative which is convenient to all of us, right? There are still a lot of unachieved things for us in Mohammadpur. Let me not paint a picture that everything is beautiful. There have been lots of road